OK, we are going to be big and brave and bold, and we're going to reform the NHS. Robin's in Chelsea to get us started. Right, I've got my pen, I've got a piece of paper. What are we going to do? Good morning.
Good morning. Well, I think we ought to add some sort of charge. So charge people in some way to use the NHS, because at the minute, a vast majority of people in the UK think it's the government's responsibility to look after their health.
Totally agree.
Sorry?
I totally agree.
Right, yes.
Yep.
And then people would take it more seriously, like other aspects of their life. I mean, people are happy to spend thousands or hundreds on holidays and entertainment, but spend nothing on health. I mean, a lot of people, would rather spend time limping round than paying privately when they've got the money. So it's...
Do you, Robin, like me, think that a small number, but some people... It's almost like part of their day out, that they go and see the doctor or they go to a clinic or whatever it might be. For some, not everybody, it's almost like that there's actually nothing wrong with them, but they just feel they're going to see the doctor anyway.
I imagine. I mean, because it's free. It's
I know.
Free, so why not? And I know these stats are quite shocking in terms of the number of people who don't turn up for the appointment. But my dentist charges a fortune if I don't turn up. There's no way around it. But my doctor, if I don't turn up, then so what? It's so I think the minute you introduce charging in some way into the system, that will make a big difference, and people will take more responsibility and more value, because a lot of people don't value it.
If you're getting it for free, you don't attach a lot of value to it. Robin, thank you. I asked you to be big and bold, and Robin has been. Some form of charges. Now, obviously, I'm sure Robin would agree, if you're vulnerable, if you're unemployed, if you're living on a pension, no. But somebody like me, I promise you, if I could ring my GP surgery later today, fortunately, I don't need to see the doctor. And can I come and see him or her at 3 o'clock this afternoon? That'll be 40 quid. Yeah, fine. Fantastic. Not a problem. Boom. Done.
I'm ringing really about this charging for GP appointments.
Yeah, great idea.
This hasn't really been thought through.
I thought through at least half an hour.
Okay. Right. So you've got an appointment at 9 o'clock with your GP.
Yep.
Before that happens, you've got some domestic crisis that has to be attended to at home. Okay.
Right.
So I believe that most people would ring the GP and try and cancel so that somebody else can have that appointment.
Yep.
Okay?
Yep.
You cannot get through to do that. Okay?
Well,
you cannot afford to be hanging on the phone for 20 minutes, because you have to go and deal with your crisis.
Can I just briefly... The surgery you use...
Yes.
Do you get a text telling you the night before that you're seeing Dr. Jones at 3:30 tomorrow afternoon or whatever? Do you get that text?
I don't know, because I've changed my surgery and I haven't had to go and see a GP.
So this is what I'm saying, every GP's appointment will come with a text.
Okay.
And if you have to cancel, you simply text back, cancel.
Okay. So what about people who don't have smartphones, mobile phones?
Well, they can't get ill. They're not allowed to get ill.
Okay, fine. So let me carry on now.
Okay, go ahead.
With what I was originally going to say.
Yes, please.
So if you're going to charge people 10 quid or whatever for not turning up...
Yeah.
First of all, lots of people, the kind of people who don't care about whether they cancel or not, are not going to pay that 10 quid.
But Mary...
No, listen, let me finish.
Sorry,
So the next logical step down the line is to make it a condition of registration that you give your GP your bank details so they can get into your account.
Oh, I like that idea. That's sensational.
I think that's appalling.
No, I love that. But what we have to accept, there are something like 7.8 million missed appointments a year.
I know.
7 point.
I
Now,
that.
if you do that to a restaurant, sometimes they take your credit card if you don't turn up. If you do it at a hairdresser's, sometimes they'll take a... Why do we treat the NHS so disrespectfully? You're in the NHS, you're a nurse, is that right? Morning.
Good morning, Nick. Thanks for taking my call. Yeah.
How long have you been doing that, sir?
Over 20 years in total.
How have you seen, what's the biggest thing that's changed in 20 years?
I mean, this is just my view at the moment, but when you hear the party political broadcast, we're giving this much money to the NHS. Every single year you hear how much money's being given. Mm-hmm. The actual service itself is, in my view, is just broken. It's something that can't be fixed by a stitch or a plaster. It's, people want more for their money now, but we can't even deliver basic services such as GP appointments, simple things, podiatry, hearing appointments. We just got such a massive backlog at the moment, and it doesn't matter how much money is thrown at the NHS by the government. We don't have the staff. We're broken. We're exhausted. We are trying to deliver such high quality care, but we can't because we don't have the other infrastructure behind it. You know, things like if we start charging for GP appointments, A&E gets backed up because everyone will go to A&E because they can't pay to see a GP. You have patients that are stuck in beds because we can't discharge them back into the community because there's no social care providers to be able to provide the care. It's just a never-ending cycle of failure after failure after failure in the NHS at the moment.
I make you health secretary. What's the first thing you'd do?
Do you know what? There's so many ideas out there. You know, like we should be charging for A&E, we should be charging for the ambulance service. The NHS just needs a massive. It needs an actual massive review. You know, all these politicians coming out with rubbish all the time. We're going to give all this money. It's not working. If the money going into the NHS is not working, someone needs to sit up and go, do you know what? We're putting all this money into the NHS and we're getting nowhere. Why? No one is asking the question why. Before we start putting money into something that's clearly not working, why is it not working? What do we need to do to get the NHS back to what it was originally designed for?
Well, I think a lot of things need to change, but I think I agree with a lot of the other callers that have called in. I think there's been a lot of underinvestment in the NHS, but I think investment now in the system, I think it's been kind of dismantled in a way. I can't see it working. You know, the government's, again, you know, we're slaves to the political masters working in the NHS.
Yeah.
And,
you work in the NHS as well, do you?
Yeah, I work in the NHS as well. And I think, you know, the way that the government's treated the doctors in terms of the strikes, the way they've treated the other unions, the way that they just don't really have faith in us at all. And it's just, you know, that's why then there's so much problems. You talked about, like, social care. But people need that. I work in mental health, so people need those things. So, you know, complaining about people missed appointments. Why did that person miss an appointment? It might be that they're suicidal or something, you know? And so we need then, not GPs, but we need then other staff. You know, we need like a district nurse to come in or something like that, but then that needs to be paid for. Loads of doctors are coming in here from other countries and they're saying, do you know what, the atmosphere around, you know, they feel like they don't want to work here. Other doctors are leaving.
Imran, there were 7 million missed appointments last year. Please don't tell me that was all down to people who were feeling suicidal. It's people who are It's people who are lazy. There will be some, of course, and they need to be looked after. But the bulk of this will be people who are lazy, who can't be bothered to try and cancel appointments. Now, I know some surgeries are very difficult, so we need that service where you just text the word cancel. But that's what we need, Imran.
Nick, do you think saying lazy is quite a lazy thing to do for you?
No.
You don't think so? You think that accurately describes?
If we're talking about a number of 7 million,
you're talking about strokes.
There will be a huge amount. There will be people with suicidal thoughts, sadly, and there will be people with genuine cases that perhaps they were involved in motor accidents and they weren't able to get to the surgery. But there will be hundreds of thousands within the 7 million that's just lazy and they don't pick up the phone, and it's disrespectful to people like you and others who work in the NHS.
But Nick, these lazy people, why are they doing it? They just got nothing to do.
Because it's free and they don't care.
So that people undervalue something that's free.
Yes, absolutely right. Of course they do.
So, like when we celebrate the NHS and we do all the clapping and stuff like that, we, as a society, we undervalue something that's free. We undervalue the NHS.
Well, I point you to the research last month, which shows that satisfaction is at its lowest level in over 40 years with the NHS.
Yeah. And why is that?
Principally, it was because of waits in A&E and the difficulty getting a GP appointment. Principally,
and why
those were
is
the
that?
Well, we seem to be going around in circles, but why is that?
Well,
here we go. Try 7 million appointments where people didn't turn up. Imagine, just halve that, and I've got you 3.5 million appointments. Come on, Imran, you know it makes sense.